So here we go. We're going to get into the treatment part of the laser fundamentals of really resetting the body, resetting the neurology, and then we're going to go to the area of involvement with the injury and the trauma. So we have two different things. We have an open wound that we're going to have to work on, and we have the fracture. So we're getting 4 or 5 different protocols. Okay, so we're going to be using the Avant LZ30Z to do a bunch of different protocols in the top 20. So what I like to do is I'm going to come, could you point to your belly button for me? All right, and that's good, I got it. You can take your finger away. So we're going to be using the body balance 2 inches below the belly button. And I'm going to be doing 40 seconds of infrared and then 40 seconds of red. And what this does, it puts the body back in balance. After a trauma or things of that nature, many times your more primitive reflexes get thrown off as a consequence of this, and he's having to rely predominantly on his left side to do all the work for the right side. So what we want to do, we want to bring the body in balance. We can feel that that's shifting already. And then I'm going to switch from infrared to red. Total time on this is about 90 seconds, 45 seconds and 45 seconds. It depends. If you're really good and you understand it, sometimes it's a little bit faster, but that's really where we want to start. Now, do you feel anything? Let me know if you feel a little bit of warmth or anything like that. So 90% of the time, because it's a cold laser, the patient doesn't feel anything, but sometimes we're going to produce a little bit of heat, especially in an inflamed area. So it's really important to know if it's getting warm. If it's getting warm, I'm either going to move it or I'm going to move it away from the body. Okay? Now, because I'm on the body, I'm not using any glasses. If I was getting further away or painting a big area, then I would incorporate the glasses. All right? So here we go. Secondly, we're going to come and I'm going to change this to the nerve setting. So I just go scroll through the top 10 and we're going to come to the nerve setting, and I'm going to come more into the groin area, right? So if he was able to move him, I would probably be coming into the L2, L3, L4 nerve roots, because that's what potentiates and comes back down. Now, I'm getting a little bit of the nerve supply. Remember, you can do it both in front or behind. Much easier for the patient not to have to flip them back and forth. So we're going to reset the nerve. It only takes about 40 seconds. Again, it's like bringing 1 bar up to 4 bars. Once we have that, we can come to the area of involvement. So we're going to come to that there. So now once we have that done, we can begin to treat the patient. So we're going to move and we're going to have him, you lift this up just a little bit for us, and we can see, I don't know if you can see here, we'll get a good picture of it. He's got a nice incision there, right? So we're looking at about, good 12 inches. So we're going to use the treatment protocol for wounds. So we're going to do some infrared and red. So I'm just going to come back again to my top 20 here. I'm going to scroll through it. We're going to come back down until we get to wounds. And then I'm going to go over and we're going to use that both in the red and the infrared. You can see that that's more intense, which is the red. The infrared is not as intense. So you can see it through the camera. We're not going to look at it here. Now I'm taking the area and I'm going to paint it. So even though we're not directly on the skin, the laser will still penetrate and the energy will go through the bandage. So don't worry or freak out. Again, Sam, you tell me if this starts to feel any warmth, and if it does, then we're going to go. But most of the time, 99% of the time, the patient doesn't really feel anything. So we're going to use a combination of infrared. Infrared really works more for the pain, decreasing inflammation. So I like it in times when it's an acute injury. I like it when it's a flare-up, something of that nature. I'm going to use a lot more infrared than I am red. Red is going to be really for activating the muscles and getting things to heal at a faster rate. Red works at the same frequency or harmony of a healthy cell. So when cells replicate, so just for instance, when the skin heals, an old skin cell is going to be replaced by a new skin cell about every 28 to 35 days. So using the laser, we're going to increase that by 25 to 50% faster than normal. Now, your bone, right?
Mhm.
An old bone cell is replaced by a new bone cell about once a year. But because it's an injury, it's going to go faster. Just for instance, if you break your clavicle or something, a normal fracture, how long does that usually take to heal?
Oh, I have no clue.
Oh, you
6
do. You've
weeks.
broken plenty of, 6 to 8 weeks, right?
Yeah.
Because you've broken plenty of bones. So Sam knows firsthand what it's like because I think he's broken, about 20 bones
Yeah,
or
at
plus.
least.
Yeah. Well, there's 206, so you have like 175, 80
To go.
more to go, right? But you've broken this one twice, so we'll count that as well.
Unspoiled territory.
Yeah, that's right. So we got that one going again. So we've been doing infrared. Now I'm going to switch to the red. Well, don't look at it for me, and I'm going to stay away from it too as well. So again, we're just painting the area back and forth. Normally for this, it would be about 5 minutes, normal protocol, and it's just back and forth. So it sounds crazy. You're thinking this little laser really can't do anything, but the work that we've seen with wound healing and burns is phenomenal. So anything with skin, because it heals so fast, you see great results really, really quick. So we're going to continue here for a couple of minutes, and then we're going to come up to the area where the fracture is. So we started with our first point, which is 2 inches below the belly button, to reset the body. Number 2, we went to the second, which is the nerve, right? So you have to stimulate the nerve, raise it to 4 bars, increase the frequency of firing that nerve, and when you do that, you're going to heal about 25 to 50% faster than normal.
Right.
Now, you've used this laser for other things, and
Yeah.
tell us a little bit how it's worked for the gout. You got a little spot of gout there on your knee, don't you?
Yes, I'm looking forward to using it on it. I've taken the medicine and it hasn't affected it very much. Last time I had it, it knocked it out in a day, day and a half.
Right, which is unheard of. So
For gout, it is unheard of.
yeah, so I've had the gout, right? You
Yeah,
have the gout.
absolutely.
So how would you compare the gout to this injury?
This is where my pain's at.
That's where the pain's at. So
This is not that bad.
Not
This
that
is what hurts.
that's it. So the laser using for gout, which is probably the most painful thing a man can have,
Yeah.
not like birthing, probably for giving birth or a woman, is so painful it's ridiculous. And so to knock it out in a day and a half
Mhm.
is like a godsend. It really is.
And I'm dependent on this knee right now.